Good morning, afternoon, wherever you are in the world. Thank you for coming here to be with us today for a presentation on the digitization of occupational health and wellness. So without further ado, I'd like to introduce you to Dr. Farrell Cahill, who is an occupational health and safety scientist and product specialist with TELUS Health Care Centres, and he's going to walk us through the presentation today.
Great, guys. It's really fantastic to be here. I really do appreciate everybody tuning in today. Pretty excited to talk about this topic. I've been in the field of occupational health for many years, and I believe that digitization is our true future, and I'm really excited for everybody to be here and to hear about some of the things that I have to say on the topic. So let's move ahead directly and make sure that here we go. So today's topics, we're going to talk about the rapid change and delivery of occupational health and medical services, the how and why. We're going to talk about the future of occupational medical and wellness services as well, and then those essential technologies that are providing comprehensive care for the workforce. So we're going to be talking both about that individual patient perspective and also that organizational perspective. It's important to understand there's a differentiation, as you can understand, as our organization size grows, and we need to talk about both of those topics. So again, I am Dr. Farrell Cal. Again, I'm an occupational health and safety scientist. I do research and work in the area of chronic disease. I've done so throughout most of my work professionally, and I've been spending a significant amount of time in occupations and understanding what can organizations do to be able to help to solve the strife, if you will, of what's happening in the Canadian population with regards to chronic disease. We have, again, a responsibility and a role to play in how we're going to be able to help Canadians to stay healthy within their work, and to be able to do so in such an effective way to allow them to have, again, a great life outside of the workplace. So it's very important that we understand that's our duty of care as an organization to provide the best willingness of health that we can for our workers. So it's important that we look to provide those things and promote organizations to do so. So my background specifically has been doing a lot of work in looking at how do we find a way to increase the defendable position for screening purposes in the occupational health space. But then I started to see a significant number of gaps in the way in which these things are connected, and started to see more and more the pathway that's necessary for the digitization and being able to bring these things really pretty much to the fingertips. How do we make this a livable opportunity for us to work within? So again, it's very exciting times. So we are the TELUS Health Care Centres. We're, again, a multinational organization that provides services across Canada to many organizations with respects to all aspects of employee health, from primary care, patient care, to specific organizational solutions that are needed to increase the well-being and health of our employees and organizations. So very excited to be here. We are an amalgamation of many leading brands, and being able to produce, again, best standards and best practice and thought leadership in this space of being able to help people with the best potential medical care and overall health and wellness and well-being for our organization. So very excited as we continue to move our pathway forward to bring our organizations together to continue to bring you the best potential services. You may know us as one brand or another, but so definitely be very excited about the aspects of understanding what's to come as we come together and continue to deliver to you some extraordinary services, and especially on the topic of digitization. It's going to be a great digital transformation, and being able to bring things to you and bring power to where we are with documentation, trying to make those documents livable so that you can start to make just important decisions. We need to empower organizations to be able to make decisions. Helping them to bring lines of business and their departments together to be able to make those decisions is also critically important. Organizations, as they grow in size, have lines of business and breakdown at times between departments when it comes to lines of services. And we really need to include that circle of care and break down those barriers and help to support it. And that's pretty much one of the important aspects of the TELUS Health Care Centres. We have, again, many service types that are being delivered, as we've just mentioned, very comprehensive in the way in which we can help to deliver comprehensive primary care. Again, that may be to executive or any corporate worker within your organization. So very important we understand we have a lot of viable tools, especially in the digital space, to be able to help you today. We have a lot of corporate health services, may they be wellness or otherwise, and to being able to help to understand your occupation and being able to deliver solutions through occupation. You're going to hear me talk about this quite a bit. It's my philosophy, my belief base, and the idea of us being able to help every employee, independent of the demand of their job, high risk or low risk. Very important to know just how extensive, as we come to that third line of service, occupational health and safety and occupational health related services. Now, I never say occupational health and safety, it's occupational health for safety. The machines, the processing is just as important as the health of the individuals that do the work on our sites, no matter where they be, remote or urban. And our philosophy is to find the best way of pushing the solutions through their occupations, trying to find a way to empower them with as much medical information about themselves as they can to empower their journey. But how do we help them as well to bring these things together, to support the initiatives of organizations to give them independence and power while we were able to support in solution development. So our occupational health and safety and occupational health solutions are very important to us and can span actually into areas you may not have realized. So we're excited again to be here talking about this today and to continue to expand your understanding of where we are with some of these related services. So we're going to jump in and just look at the current landscape. This isn't something you're unfamiliar with, but it still needs to set the stage. We need to talk about this as we continue to understand the importance of occupational health, that idea of medical clearances and surveillance and understanding how our environments may impact our workers mentally, physically. We need to be inbound and we need to be able to be responsible. So when we look at the Canadian population, unfortunately, we're seeing a significant increase in chronic disease development. We do need to do our absolute best to try to figure out how can we help them to increase their mental and physical well-being, not just for work efficiency, but for the overall well-being and value, to wish for them to be with an organization that takes that level of care for their development. Extremely important for us to get the best of what you need for you to be able to be efficient and maintain production and do good work. But again, we can very well see that maybe one, if not many of these that are on this list to my right, are probably present in many Canadians. And that's why it becomes ever so important for us to understand that our responsibility to our employees doesn't stop with screening and medicals that are needed for hygiene surveillance. We need to do a little more to be able to help them, to help us, to be able to be the best organizations we can be. They are the lifeblood, they are our asset, and we need to do our best to give them the guidance they need just as much as we do our systems, machines, engineering, and projects. They will pay dividends back on us. So very important that we understand again that these chronic diseases are not only present, but they're rapidly increasing. And this is the very important message. We need to understand that this is getting worse. I've said this many times, and I'll always say it for my philosophy, is that we don't have a problem raising children. We have a problem raising parents. And I only say that in the regard that it becomes very difficult to know where's the support that they need to help to measure their own health, exercise or otherwise, and how do they do it again for their children? There's a gap here. And in my mind, and I've been in this space for such a long time, I truly believe that organizations have a great opportunity to be able to support their employees of giving them the fulfillment that we need and helping all of Canadians to be able to increase their overall health bound situation, to be able to lower chronic disease. So I believe organizations have the greatest role to play, and why, again, I always need to lay this out before we begin into any topic. So very important, and we understand that we need to try to help and support our workers, no matter independent of the level of demand of their work. And one of those leading causes is things like energy surplus and obesity, the consequences of eating too much and not doing enough physical activity. A lot of this may be due to will, but most of it due to functions of not understanding or not having a full grasp on how they can find a way to put this into their life. We need to find a way to direct them more readily, not giving them access to portals saying that's a digital solution. We need to find a way to gather data about their occupation, about them, and develop solutions that are going to be able to help them with those situations, to encourage them, independent of their occupation, how they can combat and battle with chronic disease. Extremely important because of the significant association, as you understand, with chronic disease and injury management and incidences, absenteeism, all critical topics. And as we understand that there is a significant consequence. When we look at the consequences of not looking at these as we should, we need to make sure that we do step back and say, screening is one thing, but are they able to maintain their health after screening? What kind of supports can be given throughout surveillance and other types of treatment? If they become injured, do we have connection to that injury prevention programming with disability management? So very important to understand that there is a true circle of care that we need. And I would believe that even though we're all doing our best efforts, there's a lot of disconnection. And the philosophy has to be to make those connections and to find a way to best to do that. So we understand there's significant consequences in ignoring our responsibilities to putting health in place, to being able to make sure all Canadians have the best potential opportunity. Because again, the effects are staggering from an economical standpoint across all of our economies, and the situations that help us and understand we need to find ways of reducing those burdens. and being able to find a way to do appropriate and expensive accommodations when things do take place. But again, it's that ounce of prevention approach and trying to find the best potential solutions for, again, our organizations is absolutely necessary. In 26 billion in total economic burdens of injuries across Canada. I mean, this is an older statistic. This number is even greater now than it was. And the idea of looking at the significant amount of claims that we see in musculoskeletal injuries and understanding that they must know how to protect themselves for their occupation. There may be efforts made, but are they truly designed in a generic way, or are they truly following that occupation-specific approach, which is so critically important? We must try to find out as much about the specific occupations that we can, digitize that information, and empower as best we can. So we come to the landscape of change. This is the idea of us saying, look, traditionally, we see that there's organizations are making attempts to obviously put and connect their employees. That's most evident. However, the technologies usually delivered, again, don't understand the complexities of the physical and mental aspects. Mental aspects have become so important. If they haven't been properly measured, quantified, you will find that you will be, again, exposed and not unable to deal with, again, the situations that you're being faced with from day to day. There are going to be obviously socioeconomic situations, but your overall occupational situation is going to play a role in being able to try to help not only from the physical aspects traditionally, but now looking at how can we provide those mental supports that are ever growing and necessary, especially now in these times of understanding how difficult it must be to be so isolated from one another, and where we need to be thinking in that way. Our occupations, again, play a significant role. We need to look at the simple forms of our occupation and where we can tie things together, and why it's important to digitize that. So the idea of portal access is really not where we need to be. We need to step forward a little bit and try to find out what's kind of coming next. So realistically, when we look at that landscape of change, where are we looking to go? Traditionally, again, that digitization, as I've said, in the workplace evolves around connecting your employees. The idea of saying, okay, we need to digitize a document, but is it digitized? Is it just a scan? Is it that when you do try to connect individuals, they're being connected over a way in which it's just helping with communications or secure access to their systems when they are off-site, which we're seeing a great deal of off-site need of access, and we are increasing our digital footprint in that regard. But that's not, in the OHS space, we need to do more than that. And the fact that these forces are upon us, we need to take advantage while they're here to understand more about them. I mean, research out of the United States is showing that 96% of young workers have smartphones and are using them readily, and a significant percentage of them, ever-growing percentage, is their only means of access to the internet. This is a very significant statistic to understand that they are utilizing their mobile devices more so every day for everything that they need to do. And us as occupations and providers of solutions to occupations need to think about leveraging those mobile devices to create access and opportunity, not providing the traditional portals and accesses within the scope of our workspace, but looking again more dynamically and more demandingly in a way in which we can be more flexible to provide those solutions. And that's really what's important. So we look at it and saying that the mobile device has also been a global surge under the pandemic, a 70% global increase in the usage because of COVID-19. It's important that we look at that statistic, but then even dire as it may sound, we have a gateway to the opportunity to help them right in their pocket. This is actually quite exciting in the fact that we're able to now be more connected to them in a way in which we can support them. There are negative downturns to that, we'll talk to it, but there are a lot of positive dividends and ways in which we can nudge, push, and support them with things about their occupations and about their overall life. That's going to become more and more universal. And what we need to, again, in looking to supply more digital solutions and digitizing their occupations as our meaning by digitizing the workplace. So again, we're seeing rapid changes. The pandemic has had a great force on our organizations to quickly develop, robust systems. And that is something that is, again, been so tremendously interesting to continue to look at and finding out how we're using, even right now. If we had a physical auditorium to be in, it might be difficult even for us to have this audience. But now there may be more of you present because of this digital technology. This is still an extraordinary thing we shouldn't underestimate. It is very useful in our way in which being able to connect one another and support one another, no matter how far apart we may be, and how these technologies can bring us together and find ways of helping people to make them understand they're not alone. And that there is also a lot of mental and physical supports to them that can really change what we're looking at in occupational health and safety space. So very important that we look at these things and understand those overall benefits. We look at some of the evaluations, again, that have been done out of a single report. There's 217 digital healthcare markets that were actually looked at and revealed that the COVID-19 pandemic has actually accelerated our global market in digital footprint by about 4 years. So that would mean that if we were to look at it saying, we thought that in 2024 we would be where? Well, actually, we're there now. The pandemic has pushed us into the digital space so dramatically that now we're actually looking at these services for the public and for organizations, and they are, again, needed and immediate. So we're looking at saying, are you adapting to the rapid change? Are you prepared for the needs that are coming because of these pandemics, because of isolation situations, or just the digital environment, even after the pandemic is gone, to be able to help with and see the opportunities that are available when we may not have access to, again, a primary family doctor when we are a transient worker. And the fact that we may be able to have medical records access to us in our pocket to be able to now give support when we need it and to make informed and educated decisions about our health. It's a powerful thing, very powerful thing. So when we look at the highlights of these reports, it was that we need more understanding about the diagnostics and triage of individuals on the front line. Virtual care is needed, and not virtual care and automated AI systems. It's the human touch is necessary, especially from that mental health aspect, that there's other individuals on the other side that are able to relate and understand the needs that they may have with their physical or mental care. It's extremely important that we look at that and need to push that human touch. The remote work monitoring is becoming more important. Wearable devices and being able to support workers in vulnerable environments or harsh environments is becoming a much important need, and definitely looking at tying that together with how we support our triage, that we don't have to wait hours of communication when somebody is isolated or injured. We have systems that tell us instantaneously, and the idea of wearable devices supporting that approach is quite significant. Personal health and wellness is obviously have always been important, and the idea of supporting our workers and supporting them within their organizations. But now we're having ways of moving digital platforms so that on-demand solutions are available to them at work or at home, and that's become very powerful as well. And data analysis and analytics is really important, and saying, now that we have this data, now that we've digitized something and we have the data, what do we do with that? Like saying, how do we find a way to help to diagnose? So we need to empower organizations with that data and how to create new KPI, and then be able to us ourselves use that information to diagnose and create new and innovative solutions. It's extremely exciting to realize that we're in this direction and needing to go and finding out what parts of my organization haven't yet been digitized. How can I find a way to turn that into data so I can start to use it to find ways of creating new solutions or new approaches, and finding out maybe where the problem really may lie, because we've only been at the surface, and now that we have the digital data at hand, we're able to control for more things and understand more things. So this is really, again, extraordinary where we're going. So as we mentioned earlier, as mentioned, I guess, is the chronic disease management is really going to be critical. And we understand that of all our OH service regulation situations, we're looking to not have our organization impact our employees. But again, as we've saw before, 60 to 70% of the Canadians you hire will be chronically sick when hired. You know, they need support. So the idea of understanding how we can give benefits by supporting wellness for them and being able to have more on-demand related understanding, but we need to also look at a higher resolution of their occupation, descriptions and JDAs or job demand analysis that sit in filing cabinets, or maybe they've been digitized to PDF, but that's still not enough. We need to be able to compare that data very quickly, make accommodation when necessary with that data quickly. So that's really where we need to start to head. And when we talk about digitizing the workplace and those physical and mental demands, and quantify them more effectively. So it's a difficult task, but it is a achievable task. And it's something that we need to take on together to be able to achieve what's possible going forward. So again, you ask yourself, well, maybe we're doing this, maybe we haven't. There are a lot of reasons about why organizations have hesitated. The rapid change of employee duties makes people believe it's unsurmountable. It can't be done, it's too complicated. But that's one of the reasons why you should do it. Imagine having everything in one place and saying, I need to make slight adjustments to occupation or types. I need to look to make comparisons of accommodations for duty, and be like, oh, I only need to make some slight modifications and changes to one occupation versus another, and knowing that maybe 60 to 70% of occupations are similar, so the work can be done and manipulated and moved around in a positive way. So even though it may seem that's a reason to understand complexity, it's also one of the primary reasons about why that needs to be done and why we need to work at that. Altering work environments obviously is important. Are you, again, above ground, below ground? Are you working at heights? These things are obviously very important, and being able to also quickly accommodate, knowing the physical, mental demands of an individual is going to be able to empower you there. So we need to understand what can we digitize to be able to give supports of making sure that when they go from a low to high risk environment, that we're understanding the accommodations that may need to be taken so we can reduce injury and incident. This is what, in my mind, health for safety mechanisms need to be about. We need to be able to know when to make those decisions, to be able to do them quickly, rather than having to, again, look through paperwork to try to make that assumption of an individual that maybe has been with us so long that the description of the job doesn't even fit. So we do need to be able to catalog those things and digitize them appropriately. The physical and mental demands of the occupation are really that important approach. Do we understand? Maybe we've understood from, again, our evaluations of occupations from years before, but have we actually looked in and knowing now the mental demands that are placed upon us and the mental anguish that a lot of us face in this environment and in the past? How do we find a way to, again, look and measure and find out more about those mental demands and put them into place of giving support, wellness and health or otherwise, and prevention of incidents and injury through it? Physical aspects obviously are very well known, but always have room for update. If we were to look at year by year, better digitizing the demand of an occupation and lowering that percentage score, 1%, 2% by year, would be tremendous in itself for injury prevention, even with or without wellness programs being implemented. So very powerful there, and understanding that, you know, there also are inappropriate applications of new technologies, making sure that we're saying, hey, we have new technologies, but maybe we're not using them in the right way. These should be tested, evaluated, and try to find a way to see if there's any sort of, again, validity and reliability and efficiency in those systems. Understanding potential negative impacts, again, is very important, as we talked about right from the beginning. Obviously, when we expose people to conductivity, sometimes that connection makes them feel responsible at all times, when sometimes we don't let them have their time off because of the fact of how we can so easily reach out with these technologies being in place. So we need to be wary of the negative impact that these things could place upon individuals. Inadequate education and support for technologies is pretty critical. Honestly, we supply and try to purchase and provide either as a provider or as an organization to our employees to help them, but there's a significant need for education and supports for them to be able to adhere to these programs. If you were able to measure KPI for yourself and spending, looking for return on investment, it truly has to be in the adherence and the uptake of these programs. And how do we find a way to make sure we're rolling them out together as a provider with obviously an organization or vice versa. So these things sometimes are difficult, where we think we're doing all the right things, but we're not looking at it potentially in the right way. It's almost like needing multiple perspectives to make sure that what's implemented works. So inadequate education and supports are very important. And the personal fear of data exposure needs to continuously be put in place. How do we make sure that we have secure data systems that are being made available by providers to give the employees the confidence of engaging? And more, again, the younger workers, as we see, are engaging. They have that understanding, but there are still a significant level of hesitation in our current workers, our incumbents, and they need to, you know, again, be given enough time and understanding about the fact that they can put their fears at rest when it comes to the personal information that they're providing, because it's going to pay full back on them as they provide information to you as an organization or to us. The more we're able to use that kind of data to support them in a way in which, again, even they might be surprised. I've said this, and I mean nothing by it, but it's difficult for within a public system for a physician to keep track of everyone who comes into their clinic and to understand the things they do. But you can understand how important that is, of understanding what that person does physically and mentally day to day. How could we ever direct them with better care unless we knew that? So we truly do need to know that in all settings, public or otherwise, and how we help to promote them to be able to use their medical information to empower themselves, and to how to have that data to be able to empower organizations to make better and critical decisions. So we understand there's complexity here, but that shouldn't scare us away. I don't think it's going to, because there's too many potential benefits from where we're going to go forward. So the future of OH medical wellness service is really what we're here about to talk. So we're saying to ourselves, how do we find a way to start to talk about these digital technologies you've heard of, or ones you may use, or ones you may provide? And how do we try to find a way to look at those, but then make sure when we're thinking about them, we're trying to connect them? And do we have enough data to support them? Are they being implemented broadly, or are they being implemented in a comprehensive way in which we're looking to digitize our occupation? Have we done a good enough job of looking at the demands of our occupation and said, how do we find a way to digitize those things? We can't just look at the output. We can't just look at injuries, because it's so difficult. If we were to look at the straw that breaks the camel's back, the straw is only a part of it. and then we can't find solutions most often in there. We need to find a way to look at more, and like I said, digitize more, look to try to find a way to evaluate more, control for more. Just because you have data to evaluate doesn't mean you can't use controls to make that data more realistic. And that's just the scientist in me, but it's an important factor. So when we look at the ideas of booking, reporting, surveillance as, again, introductory technology, we would say to ourselves, this is something we should expect now in this time frame. However, are they connected? And that's important. The idea of saying that booking systems, reporting systems, and surveillance should be connected in a system that not only be a platform for the employee that goes through the system, but the employer to be able to have access to the clearances and critical information they need, again, to be able to consistently do work, to save effort on their end, to be able to make sure that we're saving money and effort on that respect, and that being able to use this information more for solution production than it is for just being able to have ourselves meet the minimum criteria we need to do our job. So very important we look at saying that there's rapid changes. We need to look at this from an ecosystem perspective. So again, as we talk about, and as we're going to, the types of tools that are here, how do we find a way to always be thinking about how they connect to one another? And the fact that we need to try to find a way to make them connect with one another. And do we need to look through our department issues or our lines of business? Are there things that, one line of business or organization within ourselves likes to do versus another, and we have some challenges to find a way to bring them into the similar ecosystem so that we can all support one another with providing best solutions. And that's important. That's a responsibility for organizations and ourselves to help support and that type of thing. So important that we think about, again, what's necessary in that regard. So when you think about essential technologies, here's, again, some of the ones I believe to be critically essential. There are others that are not currently on this list, but these to me are strong core necessary OH services. Services that we need to be looking for, saying, okay, do we have these? And if we don't, do we have the ability not to implement it? What I mean to say is when we do the risk evaluation, is there a need for it? And to what need and level is there for it? Why, again, some organizations need or may not need to do screening. So we need to look at saying that even though we do not need to do screening, doesn't mean that the screening itself can have significant benefits on our organization, their health, their safety. So we need to start looking at saying, can we actually look to increasing the physical demand screening processes so that we can try to find a way to reduce physical demand readily and try to find a way to increase the entrance of workers. So again, many services here that you will see on this list. Again, we can pickpocket a few of these here, saying that virtual injury prevention is definitely something that's becoming critically important, and saying that if we're going to digitize anything, when we look at trying to find a way to promote injury prevention, we need to find a way to be able to connect with organizations, because it's difficult, especially now with COVID-19, to be able to interact with them. So we need to move those solutions and opportunities onto virtual platforms so that they can be not only readily accessible on demand to individuals, but to help organizations to run those programs. Again, the idea of virtual health and wellness, the idea of finding ways of being able to support through either back-end EAP or the idea of just corporate wellness initiatives necessary for us to look at saying that, yes, that should be a part of what we do for our OHS concepts. So we're going to dig in a little specifically, but these are definitely, to me, some of the essentials, and we're going to talk about some of the specificity of those now. So the idea now, and what we're seeing in the idea of electronic medical records is definitely a very important technology, and we need to start thinking about it more and more. That we may have ways in which we're taking information from providers into medicals, but do they connect to their actual medical records, and do they have information about them that empowers the patient themselves and the organization to make those decisions? So the idea of electronic medical records is definitely becoming a very significant contribution in the OHS space, and being able to find ways of us putting that information together so we have more available for everybody. Rather than a case-by-case situation or a job-by-job situation, we may be able to look across opportunities to be able to understand the true impact of the organization on an individual and differentiate from previous stages in a very quick, very fast, and efficient way. So very important that we look at what EMR systems can do and our ability to interact with our employees, and how we can then, when we're looking at developing screening processes, needs for accommodation, we have a lot of digital information with us to make very quick decisions. Again, the electronic health record is also very important on top of an EMR type data collection system, and saying how do we also have technologies available to us that allow us to, again, give a space for the organization and for the patients to be, and being able to look at these records and keep records in one place. Again, we all do a great deal of significance in needing to look at surveillance very often, and the idea of looking at saying how can we look to try to find a way to empower us in looking at our surveillance more readily, and more quickly, rather than by a certificate basis, maybe, again, more resolution and more data, being able to put it into a space where we're able to look at it with, again, a finer tooth comb, if you will, about making sure that these solutions and these impacts from these solutions are really being paid attention to and looked at. So as we've been talking about all through this, we've been saying that we need to digitize the workplace. So we think that we need to think about what are those factors about my workplace that I haven't digitized, if I haven't. And when I say digitized, I don't mean that I've put them from, again, paper to a digital piece of paper, meaning that the data isn't extracted, it isn't put into fields where it can be used or compared. That's what we need to be thinking about, not, again, just it being an electrical file that can be sent from one place to another. That's not what we mean by digitizing the workplace. That's a traditional sense of it, maybe, but when we think about digitizing the workplace, especially for occupational health solutions, we need to be looking at all of the potential data about the occupation. And one of the great and efficient ways of doing that is saying, how do we find a way to bring those JDAs, PDAs, whatever you may call them, how do we bring those into a livable place, a place where you can use them more readily every day, rather than being used only on incidents of needing to create hire situations or, again, return to work situations. We need them to truly be able to run and be able to be the basis of how we run things. And how do we find a way to empower our organizations or even ourselves in being able to create solutions from them? So when we say digitizing the workplace, a lot of this is driven through the idea of using these, again, JDAs, trying to find a way to move outside of just simple ergonomics and think about those mental aspects, those other physical unique aspects. What other parts of the organization do we need to, or within our organizations, do we need to look at about an occupation to get the best potential use of data, environmental cues and circumstances and impact of those things? So it's important that we try to, when we say digitize, that's what we mean, those demands, those things about the occupation that maybe we could change, maybe that we could improve or manipulate in some way that could cause an increase in opportunity for people to work with us or to lower incidence of injury. So when we think about the idea of doing medical screenings, that's usually a critical piece for a lot of us, and the idea of screening and applying in that sense. And having access to a digitized occupation is going to be very powerful, and being able to make changes as we need to. As the changes come on your side, we're able to update and change them on our side or any provider side. So it's important that we understand how digitizing is going to become a way in which we can, again, adjust very quickly and be in the right place where we need to without going back to the drawing board and re-engineering, rebuilding things from scratch. So the physical pre-employment is also important to differentiate between medical and the idea that, yes, medical is something that needs to be done for certain circumstances for critical levels of essential health, but there is still a critical, minimal, and essential need for your job from a physical and mental aspect. And we need to kind of look at those physical and mental pre-employment aspects and trying to find a way to measure and filter those things. And again, the more resolution that we have available to us and the more readily that changes, we're able to update and stay present. So that technology is definitely critically necessary and needs to be, again, adapted and changed as we go forward. So again, this type of again, digital occupation can also be very beneficial for things like disability case management. Disability case management, as we know, is helping to return people to work when an injury or incident takes place. May it be, again, occupational or non-occupational. But again, we're looking at saying that how is it that we return somebody to work unless we understand the physical and mental demands of the occupation? We can't separate the two, so they're a part of that circle. They're a part of, right from stage one, new applicants and incumbents with processing, and then saying we could use that information to support with wellness initiatives, injury prevention initiatives, screening initiatives, physically, mentally, or otherwise, and medically. And then saying these are the things that should be the same processes by which we help to return to work. Sometimes the case management situations and the pre-employment situations are segmented, siloed. They're not together. We need to not only look to digitize them, but we need to connect them. How powerful is it that when we are finding a way to do so, that we're able to communicate with one another about being able to make adjustments as necessary? Because in my mind, it's always that effort of saying, how do we find a way to work together with organizations to try to find a way to reduce the physical demand of an occupation year by year, inexpensively, to create positive impact besides injury prevention traditional programming. So very important that we understand that disability case management is one of the greatest things I think we need to connect into when it comes to where the occupation information is, how do we digitize it more effectively, have it at our fingertips to be able to move forward and connect more readily with those technologies. The thing that's also become critically essential, as we've talked about, the solutions really to a lot of our problems are in their pocket. They're carrying around a device that empowers them to be able to communicate with a human being immediately, and not just by hearing, but by visual, being able to communicate by them with video. Seeing an individual at a time of distress, when we think about mental health issues, has become quite significant. And knowing that a human being, another person is there, not a process of algorithm that gets you into a system where, again, things can be dropped. And at the same time, we need also this system to understand your occupation, to understand the demands of those jobs. And you just start to connect those things together and saying, yes, we have this available to us, but do we understand the frequency by which we can support the usage of the systems and how beneficial it's going to be to try to really help with things like your absenteeism that you may face, or being able to find a way to deal with those issues. Because it becomes extremely important about the technologies that can be developed when we think about on-demand, video communication situations that help us with our primary care or any other aspect of our overall health and care. And for me, it's the development of those, again, ill and injured worker is the terminology I use, but the idea of a triage, a system that obviously is built into, again, an on-demand system that says, hey, I need support. And now think about it from, an organization, saying, hey, it would be beneficial for me that if I do or don't have a clinic on site, to understand what kind of, again, OC decisions need to be made for me, again, OC, non-OC, in relations to looking at an individual who may be injured, and how do we best manage that situation from them being able to need to go off site, or maybe they don't. Maybe there's a level of evaluation that can take place virtually that might not be a necessity of moving them off site at this time, and empower and change the decisions of being able to find a way to reduce that need of immediately enacting a solution that reduces productivity, reduces production, and reduces efficiency. So this is, again, exciting about saying that we need to look at virtual solutions, implement virtual solutions in our workplace, and try to find a way to put them into a place to support us in the work effort that we have when it comes to an injury that may take place. And how do we deal with that? May it be, again, an occupational and non-occupational related injury, to be able to, again, funnel that person through what's legislatively necessary, what's organizationally necessary, and being able to know that you're going to have a communication and consistent system. So this is exciting to know that, again, these technologies are in growth, and the fact that we're able to look at organizations in the development of these things, knowing the hierarchy and complexities with organizations. So I think this is exciting to understand that these types of technologies are coming, and that they're going to be able to have a significant benefit to processing with injury on site. We look at, again, that digitization of the EAP programs, moving away from, again, systems that move you through to a point where you're, again, not having that human contact through, again, a computer portal, a phone portal. We need to find a way to move those into the virtual space, and saying, how do we find a way that when people do need that assistance outside of primary care, but it still falls within their need of an employee assistance programming concept to be able to help them, to accommodate them, that we're looking at saying we need to virtualize that technology so that, again, there's able to be a more personal human touch relationship there to see more efficiency. Because very often we provide our employees with these programs, but they may not use them. And the reason they may not use them is because of some of these factors. And saying that now that we're at this point where digitization has increased, the transference of companies and availability has increased, we need to be able to move more fluidly between one another to be able to achieve this. So again, this is, again, an important piece that's for us to look at. So virtual ergonomics and accommodations, I think, are critical. The idea of saying that we need always, as an organization, requiring safety and changes and modifications, we've talked about them. May they be, again, electronic or more digitized workplaces and JDAs, or if they may be paper, they still develop the need of updating and evaluating and changing aspects of the job, or supporting individuals that, again, may be sitting at their desk every day, but now they're sitting at their kitchen table. So the idea of needing to again, reach out to them and give them the support they need, the coaching and education, that working in this potentially low risk environment has now increased maybe a high risk opportunity for injury chronically by not moving. Well, those high risk opportunities are saying we need to be able to use now these virtual technologies to get into your space and look continually at those human factors that can be adjusted to create positive accommodation for your workplace, to try to, again, to always be looking at that physical demand, the factors that cause the demand to be what it is, and how do we create solutions for it. And that's, in my mind, always thinking ergonomic for the sake of accommodation, for being able to increase inclusiveness and lower injuries. And I think that's obviously got to be an important philosophy of us going through that. Injury prevention programming also being delivered through, again, understanding that aspect. Every aspect of our occupation plays a role in it. If we're going to say we're going to do injury prevention, it's not just the physical demands. It's, again, what it is that that person does day to day. So traditionally here, finding a way to virtually communicate and be able to talk with one another, we need to be based off of the occupations, and we need to increase the resolution of those occupations more and more. So digitizing our occupations now in this stage of time shows us the potential benefits of the technologies that exist and how we can utilize them to create better solutions. And the idea of injury prevention has always been important, but now being able to do them more on demand and more rapidly, may they be for situations of trying to, again, prevent the injury or help people to return from it, will become almost similar to the same service. So it's really important that we look at saying that we need to virtualize these solutions and try to find a way to provide those angles of support. So from all these things that I believe to be important, that we do need to connect these things, and let alone service them and provide them. Our approach is, again, supporting that entire journey and saying that we need to properly understand the occupation to properly screen and to work tirelessly with organizations to continue to improve that, from maybe something we service now to being able to improve upon what it is that's serviced. And the idea of then saying, where can we go to make sure that prevention is present, that the worker, when they come into the workplace, are going to have the information that they need to be onboarded in the ergonomics, the exercise, the wellness, the aspects, the systems to be able to communicate with humans virtually about getting what they need for training or otherwise. To moving into surveillance and saying, how do we make sure that when we're following these occupations that we're getting the touch points that they need, not just continuous, rebound clinic visits. It's the idea of clinic visits with supports, of being able to make sure that when we're recording data, maybe about hygiene or otherwise, and the impacts of the environment, we're trying to find ways of understanding how we can better create solutions there by the occupations and changes within the occupations. And we're always looking to update things quickly. And I think you're getting, at least from this conversation, how quickly you might be able to make changes the more that you put something, again, digital at your fingertips. And in my mind, that's what excites me about this, is bringing those documents into a livable environment and then connecting them once we do that. Treatment, again, being extremely important, almost like prevention in the sense that we need to obviously treat people when we understand what the problems may be and how do we find a way to create positive solutions for them, and usually running off to the aspect of return to work. So these things, not only should they exist and be service to organizations, but they need to be connected. They need to say that every one of these knows one another and are communicating fluidly with one another to make sure that they're able to provide the best potential solutions. And very often these may exist departmental silos, organizational silos, regional silos. So we need now to break away from those regional limitations and say that if we were to digitize and move into a virtual space, we may be able to now nationalize our approach to help and support. And that's what really excites us about our approach, and trying to find a way to do exactly that. Pull away from the things that may not be necessary, that you may feel limited to, and find a way to bring it into a space where it's an on-demand and also an empowering solution. So the approach is again, very exciting for me, most definitely. So realistically, that's it. We need to look at saying our approach has to be about saying, how do we understand the physical and mental aspects of an occupation, look to our organizations to find the understanding, and say we need to stop with finding out where the gaps may exist. And there's many examples I can give about where you may have a disability management situation where there's a gap between the pre-employment that they did and that information is not accessible, or we need to pull a written document to try to compare to many parties, where if you were to hold the information in one space, they're coming to you. They're all looking at it in one place. So this is realistically, in my mind, where we need to head. This is the direction which we need to move into. And like I said, making sure that these systems can communicate with one another all the way back from pre-employment all the way to the situation where an individual may get injured, or maybe to the extension of when they retire, and what supports you may provide them if you do so in that regard. So again, these are the ways in which we're looking at saying digitizing the occupation is going to be powerful. The fact that we need to continue to find methodologies of doing that, because it's not going to be a simple cookie cutter approach here, as you can understand. We need to work with organizations to understand how this is going to be possible. But the approach truly is that it has to be occupation specific, digitized or not. We need to truly believe as organizations that we're asking providers to provide us with solutions that are truly all that we can understand about our occupations to bring the best solutions to our workplace. And that's true. That's the way it has to be. It can't be a generic blanket based approach. It has to be very specific. And digging in may take time, but the benefits are going to be significant in knowing that we're truly looking at the occupation and the solutions that can be provided to them. So again, I really want to thank you guys for being here. This is my insight on where we think we need to go with occupational health and safety, and obviously the solutions that create safety. So for me, it's occupational health and safety. But I really want to thank you for being here with the TELUS Health Care Centres and being able to hear again some of this information, obviously some of our philosophies around that. So I really want to thank you for being here and pass it off to questions.
If anybody has questions following this session, you can feel free to reach out to Farrell at the email address there. And I do have a couple of questions here, so we can get started. My first question is, what challenges do you see when providing both primary care, so treating employees, as well as being an occupational health provider and providing direction to an employer? Do you think there's a conflict of interest, or what kind of challenges would you see with that?
Yes, I understand where you're coming from there, and obviously it comes down to the privacy of information for individuals most often. But no, the individual themselves, when they come to understand, especially within an organization, their issues, may they be mental or physical or otherwise, that's the best way where supports can be provided to them. If we're providing, say, for instance, an injury prevention program to an individual, and we start to pick out things about the occupation or the individual that could help benefit them very specifically, then that is exactly where we need to lead. So when we think about it, we want to be able to provide resolution at the occupational level. So when we have individual opportunity, that is just, again, a great deal more efficient and effective in being able to make sure that that individual or those individuals that have need are going to be supported. Very often we see the early adopters and people who are encouraged by health to be the first to reach out, but very often we need to find a way to get the voice to those that don't often think to reach out, and understanding how, again, as an organization, we can help to be able to bridge the gap between what's happening with them personally if they wish to share that, and how powerful it becomes about what's the roadblocks for their occupation to be able to give them the best individual opportunity to truly be able to do their job. And I think that's tremendous. And there's a couple of examples where I've actually dealt with that and people have reached out and we've been able to solve, again, knee issues, shoulder issues based on the demand of the occupation. And they've come back with again, flourishing results because they've been able to now overcome those specific things they didn't really understand. And now that they do, they're helping themselves, they're empowered, and there are organizations seeing the benefit of being able to take that information and provide it occupationally and integrate it personally when it's possible.
Yeah, that's a great answer. My next question is, what do you think the biggest barrier to entry is for organizations to start going digital with healthcare in the workforce?
Yeah, I think some of the greatest barriers are the complexities of the organization itself. Some organizations, again, are quite diverse in what happens to them regionally, the way in which, again, they may be managed, the number of lines of business that may exist under that brand. So it's not as easy as just saying, hey, let's just sweep this positive opportunity across the country. Sometimes there's a region by region approach and trying to find a way to show that it works in one area to be able to help to develop and show and prove that that solution is possible. So I find that that's one of the usually the greatest roadblocks of organizations that realize the benefit. They know there will be a benefit in the investment, but I think the hesitation is saying, how do we work together to understand the complexities of my business and how do we find a way to do it? And honestly, we're talking about the very solution. We digitize that information and we start to show that, okay, as we digitize your organization and your region, there's now a great deal of benefit for organizations across regions to be able to have access to what you've digitized, and showing that, hey, 80% of the data we've digitized is beneficial for all organizations. It matches up with all the occupation titles and types that they have, so that they can start to look at that information and see readily potential solutions. So I think that the hesitation, though, is always that 20% on top of the various occupations they feel are different, may it be underground, overground, offshore, in the air. But I think those hesitations need to be put aside of saying we need to start somewhere. We need to start digitizing what we can, try to implement solutions where we can. And then as we are able to do this, we're able to see just how quickly it's going to accelerate in a positive direction.
So which solution would you see as being kind of the lowest barrier to entry as a way for an organization to get started with a virtual or digital solution?
Yeah. I think honestly, the most immediate providing of solutions is through virtual care. The idea of saying how that we can immediately provide, again, our employees with access to information that allows and empowers them to be able to talk to people immediately. I'm able to talk to somebody immediately about my mental health issue, inside or outside my occupation. That is an unbelievable support for an organization to provide. And then saying, okay, well, besides those things and how quickly they can be made available, as those developments and technologies then say, well, now my physical treatments can be monitored in the same right. I can have conversations with individuals about what I need to move forward. So in my mind, that personal human touch virtual care is, I think, the lowest potential barrier, because there are issues that individuals are facing and they need to deal with those, and organizations can immediately give them access to a system that they're carrying around with them in their pocket. And they don't need to put portals in place and places for them to go in terminals. The system is immediately giving them access on demand to be able to give solutions to them right away. My thought after that would be, again, let's start to digitize the occupations to improve the usage of those systems. And that's what excites us to talk about digitizing the workplace, of being able to look at the barriers and saying that we need to continue to remove them where we can and show benefit of the technologies that we're providing.
Yeah, that makes a lot of sense for sure. The next question I have here is, how does an employer see or experience the ROI of working with a provider in a digitized occupational health environment?
Yeah, this is great, because very often what we see is that we're looking at an incident that takes place and the association of an incident with our investment. That's usually the only way sometimes we can do that. But imagine looking at it in a much more dynamic way, saying that, okay, we know that the demand of the occupation said level is going to be associated with injury, incident, and opportunity. So that means if we're looking at saying, if we're going to lower the physical demand, we're going to implement injury prevention programming, we're very well able to see now the statistics are going to work better together. That when we look at an incident, that we know we're doing what we can to support the worker, and we're seeing that those statistics will change because of the fact that demand of the job is changing, because the idea of the circumstances that cause physical demand are now not present. Doing the same then with mental demand. So these injuries and incidents, can take place randomly and are very difficult to control when they do happen that way. But the ones that we can change are the ones that are being implemented by these programs. And then we'll be able to differentiate those that may happen by happenstance versus ones that may happen by, again, human error or circumstances that may have been led by their overall health circumstances. So that would mean we're able to actually show safety. So realistically, that digitizing of the workplace truly now enables you to look at a high resolution about where we can create and implement better solutions for being able to reduce injury and incidents, and the health benefits cost on top of that, let alone the maintaining of, reducing absenteeism and maintaining productivity and production.
So when the employer goes through all this work to implement all of these solutions, what do you think is the best way to encourage employees to take up these options that are available to them?
Yeah, no, that's exactly right. So that's the thing. We take up and give access to many systems. But one of the problems is that we don't often know the status of the single individual about what would best help them and how to motivate them based on what we understand. So from a personal standpoint, that's usually difficult because, again, the privacy of information, and we can get surveys completed, but not everybody completes them. So we can do front-end assessments to try to motivate us to create opportunities for a solution. However, again, what we've been talking about this whole time is that if we were to, again, continue to digitize and understand the occupations, this now empowers us to know that this is what they need as a critical need for the occupation itself. That's going to help to be able to educate them on that premise. So even if they're an adopter, or as a person who's highly motivated, or somebody who is not, you're now being able to benefit them, saying, well, based on your occupation, you should be doing these things. And we're going to provide you with opportunity and continue to push you in a direction, nudge you, if you will, in being able to utilize the things that we make available to you, because we're showing you in a very clear way why they're important based on your occupation. If it fits to you, then we're going to be able to help you to do those. If it comes down to an individual just want to need to use the system, they're only going to need it under circumstances that are hard to predict, or like you said, they're being used by early adopters. And the people we really need using the system, the ones that are more chronically sick than the early adopters, those are the ones we really need to try to help. So in my mind, this digitization is really going to be able to benefit them to isolate based on their occupation of the solutions they need to give to those occupation types, and be able to cause positive benefit for the organization that way.
Yeah, it's a cool concept, and definitely it gives you a lot to think about with how to best proceed forward. It makes a lot of sense. I don't have any more questions for you from our audience, so maybe I'll just take a minute to just say thank you, everybody, for attending, and we will be sending out a copy of this recording within about 24 hours. So if you think of any additional questions, please feel free to email us. And thank you so much, Farrell, for your presentation today. And we hope that everyone has a wonderful afternoon.
Great. Thank you very much. Take care.